Hello students, today we are going to discuss Cantharis vesicatoria. This is very important drug for mainly for urinary complaints. So common name of this drug is Spanish flies and belongs to the family Cantharides. From the name itself, Cantharis vesicatoria belongs to the family Cantharidae, common name Spanish flies. So, constitution of this drug is not given. We can say about adaptability for genitourinary symptoms, mucous membranes. So, next come to the physical characteristics. Oversensitiveness of all parts. Hemorrhage from nose, mouth, intestine, genital and urinary organs. Pain is also one of physical characteristics. What kind of pain? There is rawness, soreness, burning in every part of body. Burning is marked, written in italics. Burning in every part of body, internally and externally, with extreme weakness. Burning with extreme weakness. Disgust for everything. Drink, food, tobacco. Disgust means aversion. Aversion for everything. Drink, food, tobacco. Cannot tolerate. Disgust. It aggravates coffee. Also coffee. I am right. Coffee aggravates abdominal complaints. So, drinking even small quantities of water increases pain in the bladder. There is about thirst, there is unquenchable thirst, but cannot drink water. It aggravates the urinary symptoms. It causes pain in the bladder. Now come to the GI system. About stool passages of white, pale red, tough mucus like scraping from the intestine, written in italics. There is dysentery. Stool with white, pale or pale red with mucus, like scraping from the intestines with streaks of blood. Dysentery. There is dysentery. Now come to urinary system. Constant urging to urinate. There is burning in every part. Passing but a few drops. Only few drops at a time. Urine comes in drops, which is mixed with blood. Sometimes mixed with blood. When there is sudden desire to urinate and intense itching in urethra petrosa. There is intolerable urging before, during and after urination. Violent pain in bladder. Intolerable urging, constant urging, pain before, during and after urination in bladder. And this is also important. Burning, cutting pains in urethra during micturition. Violent tenesmus and strangury. So, during micturition or during urination, there is burning, cutting pains in urethra. But before, during and after urination, pain in bladder. This location is important. During micturition, pain in urethra. After micturition, pain in bladder. Before micturition, pain in bladder. Violent tenesmus and strangury. Tenesmus means urging. Next, the burning pain and intolerable urging to urinate. Burning in every part, burning, cutting, intolerable urging, constant urging, urine in few drops, and about pain symptoms. This one is important in urinary complaints. Is the red strand of Cantharis in all inflammatory affections. Now come to male reproductive system. Bloody nocturnal emission, night emission, leaden pall, milk salt, Sexual desire. About sexual desire, increased sexual desire, very much increased sexual desire in both sexes prevents sleep, violent priapism with excessive pain. So, priapism is painful erection of penis. Increased sexual desire, nocturnal emission. About respiratory complaints of Cantharis, tenacious mucus. In the air passes, mucus in the air passes, large mucus, urging to expectorate the mucus. Calibichrome bovista. Compare Cantharis if vesical symptoms correspond. Vesicle means bladder. Bladder. If there is bladder symptoms correspond and there is tenacious mucus in the air passage, we can think of Cantharis. About skin symptoms, vesicular erysipelas, vesicles all over the body which are sore, soreness, rawness, burning, suppurating. Erythema from exposure to sun rays, sunburn, also a medicine for sunburn, burn and scars. In these symptoms, very important. Also can be used as external application and internally also. Relieved by cold applications. Burn relieved by cold application. Burn is from dry things. Scald is from wet things like steam. Burn before blisters form. When they have formed means blister burns before blisters form. When they have formed, if the skin be unbroken, if skin is unbroken, apply an alcoholic solution of any potency and cover with cotton. If unbroken, direct apply alcoholic solution. If this will promptly relieve pain and often prevent vesication. If skin is broken, use in boiled or distilled water. Do not use direct alcoholic solution. Mixed with it boiled or distilled water, and in each case give potency internally. If skin is broken, also give internal potency as well as external application. Relationship similar to APIS in urinary complaints, you have to compare it. Arsenic, equisetum hymelin, Merxol. So now come to SK Dubey. About dysentery, Cantharis is good medicine for dysentery. Before stool, great urging for stool, violent pain in the abdomen. During stool, burning and cutting pain. And after stool, colic is alleviated, means transient relief, but tenesmus continues, urging is continued. Character of stool, white mucus like scraping of intestine, bloody mucus with streaks of blood. Dysentery is associated with dysuria, means painful micturition. About urinary symptoms, whatever disease or urinary complaints such as urethritis, cystitis, inflammation of urinary bladder, renal colic, gonorrhea, it matters little. Cantharis can be thought of as an effective remedy. Constant urging to urinate, only a few drops of urine pass at time. Violent tenesmus. There is violent tenesmus. Burning during urination is always present. Very, very important. Oversensitiveness of all parts. And hematuria, character of pain in neck of bladder. Frequent urging to urinate. Pain shoots off in different directions. Stabbing pain, burning, cutting pain in urethra during micturition. Before micturition in the bladder, during and after micturition pain is in the bladder. But during micturition pain in urethra, violent tenesmus, oversensitiveness. There is severe pain or urinating. Patient screams on passing every drop. Urine comes in drop. Character of urine, bloody urine comes drop by drop. Urine scalds the passage. There is retention or suppression of urine. Passes only a drop or two at a time. So about modalities, aggravation during urination from touch, drinking water, coffee. Amelioration by rubbing warm application, written in Clark. So all about this medicine. Thank you so much. Please like, share and subscribe my channel.